First, I would start by washing my hands and introducing myself to my patient. Hello, my name is Shaquila. I'm going to be the nurse practitioner taking care of you today. Could you tell me your name?
Michael.
Hi, Michael. Do you give me permission to record and upload this video so that my professor can view it and grade it?
Yes.
Okay, thanks, Michael. I first would start my cardiac assessment by doing a blood pressure. I would start in the left arm. I would do it with him sitting upright, well, supine first, and then 20 minutes later I would do it upright. And I would do it in the other arm with him supine, and then 20 minutes later with him sitting upright. And I would compare those readings. Next, I would start with my jugular venous pressure. I would have my patient lie down. Can you lie down for me? At 30 to 45 degree angle. And I will look for the venous pressure pulsation, and at the highest point I would mark it, and I would measure from his sternal angle, and it is 3 centimeters, which is normal reading. Normal would be less than 4 to 5. Next, I would auscultate his carotids. Okay, I didn't hear bruit. Next, I will palpate the carotids, and I would do each one separately so that the patient wouldn't get dizzy or pass out. And I did feel a little brisk up streak. Next, I will visually inspect his chest for any deformities. I'm gonna have my patient sit up. I don't see any apical pulsations, any pericardial pulsations on his chest. Next, I would start with palpations. I would palpate his PMI, which is the 5th intercostal space. And once I felt that pulsation, I would find his mid-sternal line and measure, which is about 3 centimeters, which is a normal finding. Next, I would palpate for heaves and lifts. Place my hands on my patient's chest to see if my fingers lift any, and they're not lifting any. So that is a normal finding. And next, I would palpate for thrills. I would put the palm of my hand on his chest to see if I feel any vibrations, and I do not feel any vibrations. Next, I would have my patient lay down. I would palpate his aorta. And I would go 2 centimeters above his umbilicus. And once I feel it, I will go out till I can't feel it on both sides. And that is the aorta. And as long as it's not bigger than about 2 fingers, and his is not, then we don't have any dilation or anything. You sit up. Next, I would start with my auscultation. I will auscultate his chest. I would start with the aortic area, and I will auscultate the diaphragm and the bell, then the pulmonic area with the diaphragm and the bell, and the tricuspid with the diaphragm and the bell, and the mitral area with the diaphragm and the bell. Next, I will auscultate for the splitting of S2, which is at between the 2nd and 3rd intercostal space. Take a deep breath in and exhale. I heard the splitting of S2 on inhalation. If I would have heard it on exhalation, that could indicate some kind of problems with his valve. Next, I will auscultate Erb's point, which is the 3rd intercostal space. Near the sternum. Okay. Next, I would auscultate the aorta. Let me have you lay down. Listening for any bruits. I don't hear any fluid. Next, I'm going to check my patient's extremities, his upper extremities and his lower extremities. I'm looking for any edema, any varicose veins, and I'm going to feel his skin, see if it's warm. It's warm to touch and no edema. Next, I'm going to do his pulses. I'm going to start with his radial pulse. It's 2 plus. 2 plus on that side and equal, and no, I did not feel any thrill. Now I'm going to do the brachial pulse. 2 plus. 2 plus, and it's equal on both sides. I did not feel any thrill. I'm going to have my patient lie down and I'm going to check his femoral pulses. 2 plus. 2 plus, and it's equal. No, I did not feel a thrill. Can you sit back up for me? Next, I'm going to check the popliteal pulses. 2 plus. 2 plus, and they're equal. I did not feel a thrill. Next, I'm going to do the dorsus pediis pulse. 2 plus. 2 plus, and equal on both sides, no thrill. And the last one is going to be the posterior tibia. 2 plus. 2 plus, and they're equal on both sides. Next, I'm going to check my patient's fingers for capillary refill. And they're less than 2 seconds. I don't see any clubbing on his fingers. And I'm going to check his toes for capillary refill. And they're less than 2 seconds as well. And that's the end of my cardiac assessment. Thank you.